Oh, hi, I'm Mimi, and you're you, and this is my witty bitty life. So, I am sitting here about to do my treatments. If you are new to the show, which you're all new to the show because it's a new show, I have cystic fibrosis. I also have diabetes and a bunch of other slew of health conditions that definitely put me in the pre-existing condition pool. And I'm just watching all of the what's happening with healthcare, especially with the vote this afternoon, getting all that news. And my automatic response to that is just like feeling very isolated and feeling very left out. And I know that there is, one of the things they put in an amendment at the very end was that $8 billion to help with this high-risk pool, and I would assume that people with pre-existing conditions fall into that high-risk pool. But just in general, that we have passed a law that lets people write me out because I cost too much is just really hurtful. And yeah. So yeah, that's like just my initial gut heart reaction to this, and so I was going to share it with you guys. And I loved watching this week. What I really wanted to share with you guys was this Jimmy Kimmel video clip that he did, and I'll link to it below. But he talks about his son who was born recently and has a heart defect, and that the doctors were able to identify that, doctors and nurses, and to perform life-saving surgery on the little boy. And he's going to have this, problem condition probably the rest of his life, but they've got surgeries that, he'll be able to live a happy, normal life, hopefully. And one of the things that Jimmy Kimmel talks about, which I just love, is that he says when he was in the hospital with his son, he was just, kind of in awe at how there were so many families there from different financial backgrounds and different professions, and that all of their kids were receiving the same level of care, and that it didn't matter how much money you made, they were going to save your kid. And like, how fundamentally truthful is that, and beautiful and wonderful. It's cool, I think. And I always have just I am in awe. I am thankful that my place in this world was to be born in the United States, to be born into this privilege of healthcare, because for me specifically, like, I wouldn't have made it had I been born in a third world country. People with CF don't live in third world countries and make it very far into life. And so, that is just the weight of that privilege is not lost on me. It's very amazing to me every time I receive healthcare, every time I'm in the hospital. I'm just pretty much in awe. Can't complain too much because getting life-saving stuff done. But, and Jimmy Kimmel goes on to say, and I thought this, I don't have the direct quote, but I think this is very true. He talks about how that's not a Republican thing to want or a Democrat thing to want, that idea of wanting to save babies and save lives and make sure that people can be taken care of and be healthy. That isn't like a bipartisan issue. I have a lot of family members and friends who are Republican, and I don't think that they like me less because I have a pre-existing condition, or that I oh, there's that condition. Not the neck rash. The neck rash is still there, though, guys. But I don't think that all these people, these Republicans in my life, that they don't want me to be taken care of. And so it's just really mind-boggling to me right now what is going on, because I very much feel like these measures are not going to take care of me, we could be without insurance really quick. So we get health insurance through my husband's work, which is at a church, and I'm really grateful for that. And I've always actually had employer-based health care, and I feel like that is part of the part of what's wrong with the system is just employer-based health care in general, because when additional things need to be covered and when insurance premiums rise and all of that, like the burden a lot of times will fall on an employer, and that seems really odd to me. Like, why do we expect our employers to provide insurance for us? Why is that the system? We don't look to our employers for anything else. It's just a really weird thing that it's tied in, and I don't really understand why it is, but I do see from like my family's perspective, from other small business owners' perspective, that is a reason that they can be against some of the ACA measures and against some of these health reforms, is that a lot of the financial burden will fall on business owners, and that is just sort of weird to me. I kind of feel like it should all just be like an insurance marketplace, and I think we should all have insurance, be required to have insurance, and we're all in the game, and we all pay for our own, and they don't charge people who have pre-existing conditions and people that actually are sick astronomical rates, because there's enough people in the pool that we're all sort of covering each other. I know, it might be a socialistic dream, but it's my dream. It's my dream. So, anyways, I don't know. Maybe this is me being idealistic, but I feel like the promise wasn't to repeal Medicaid and wasn't to pull back pre-existing condition coverage and all the things that I feel like this bill is doing. And maybe there's a bright light somewhere at the end of the tunnel, but this was a real dig today. This was, kind of harsh to hear. All right, so this might be a sad way to end my new series, but hopefully you learned something new, and hopefully you heard my story a little bit, and that helped you see something from a perspective of someone with a pre-existing condition. Maybe you have a pre-existing condition and you don't agree with me. Would love to hear from you. Would love to hear from anyone who doesn't agree with anything I said, but in a really loving, kind, respectful way, please. But I think it's important that we all listen to each other, even when we don't agree, even when we think we're right. I think those things are important. So comment below, like and subscribe. Please stay tuned for tomorrow's episode. It's all about CF, because May is apparently Cystic Fibrosis Awareness Day and month, not day. And I want to talk about it. So here's a little preview sesh. Here's me in my vest. Yay. You'll hear more about this tomorrow. Thanks. I love you guys already. I really, really do. Okay, bye.